Next is metabolic bone disease. So what is metabolic bone disease? It is due to change in calcium and PTH level. Okay. So what is primary hyperparathyroidism? So PTH is released from parathyroid, which maintain the level of calcium in blood. So what is the action of PTH? So what is the action of PTH at various level? So in bone, it causes bone resorption. At kidney, it causes calcium absorption and phosphate excretion. Okay, at intestine, it causes bone calcium absorption and phosphate absorption. So because it is causing bone resorption at bone level, so in skull it leads to salt and pepper appearance, because primary hyperthyroidism is due to excess of PTH, secretion of excess PTH. Secondary is due to hypocalcemia, which increases the PTH level. Okay, resorption of lamina dura in teeth. In bone, you will find brown tumor, painful bones, renal stones. So patient will present with abdominal groans, psychiatric moans, accumulation of blood in cavity, brown tumor. Patient will present with lethargy, fatigue, nausea, vomiting. In phalanges, subphalangeal absorption, osteitis, fibrosis cystica. Renal, it causes, in secondary parathyroidism, it is causes Ruger Jersey spine. So these are due to excess PTH. So excess PTH could be due to parathyroid adenoma, parathyroid carcinoma, which leads to increases in PTH. Okay. So this is the action of increase in PTH. Primary hyperthyroidism leads to these type of this excess parathyroid hormone leads to salt and pepper appearance in skull, resorption of lamina dura in teeth. Okay, next is rickets. So in child, in infants, in kids, vitamin D deficiency leads to rickets. In adults, it leads to osteomalacia. So if the vitamin D does not absorb, it causes vitamin D deficiency, or due to any cause, if the kid is not getting vitamin D, then patient will present with craniotapes, skull, ping pong like skull, softening of skull is the earliest change, rachitic rosary, non-tender costochondral swelling. You have to understand it is non-tender because there is tender swelling in scurvy. So this is the difference between both. Patient will present with delayed closure of front nail, wide suture, bowing of legs, bow knees, genuvalgum, zeruverum, wind swipe deformity. Okay. So these all are the features of rickets. Now it is two types: vitamin D dependent. So vitamin D dependent, it is type 1, it is mutation in alpha 1 hydroxylase, and type 2 is it is resistance of vitamin D. So it is vitamin D dependent. Now the various features, Harapic DC हो गया. It is the mnemonic. What is the mnemonic? Harrison sulcus, rachitic rosary, ping pong like skull, genuvarum, delayed closure of front nail, craniotabs, hypoplasia of enamel, genuvalgum. These all are seen in, these features are seen in rickets. So you can remember by Harapic DC हो गया. What are the laboratory parameters you will find? Calcium is decreased or increased. Why it is normal? Calcium is decreased or normal. Why it is normal? Because though vitamin D is low, but it increases the PTH, and which cause the resorption of calcium. So it increases the PTH. That's why it is normal. Because hypocalcemia induces PTH to release. So PTH causes calcium absorption from GIT and kidney. So calcium level will be normal. Okay. X-ray shows cupping, splaying, and fraying. You can see this is cupping. It is cup like. So cupping. This is splaying. This is fraying. Multiple these are fraying. Okay, increase epiphyseal metaphyseal distance. So you can see these are the seen in distal end radius or knee. At wrist, you can see this type of picture. In knee, you can see this type of picture. Cupping, splaying, and fraying. You can see this is the formation of cups. So cupping, you can see this is splaying, fraying. Okay, and bowing of legs. Okay, so these all are the features in rickets. Now osteomalacia. So osteomalacia is the vitamin D deficiency in adults. So patient will have Looser's zone. Looser's zone are pulsation of artery around the bone, which causes the stress fracture. So this is Looser's zone. So Looser's zone are seen in Rupa hi-fi, renal osteodystrophy, osteogenesis imperfecta, osteomalacia, Paget's disease, hyperthyroidism, fibrous dysplasia. Patient will present with protusa acetabuli. So patient will present with protusa acetabuli, champagne glass pelvis, triradiate pelvis. Okay, then there is another disease, achondroplasia. In achondroplasia also you will find champagne glass pelvis. Okay. So how will you treat this osteomalacia patient? By giving 3 to 6 lakh of international unit of vitamin D, IM or oral. Next is scurvy. So scurvy is due to vitamin C deficiency. So vitamin C is used in collagen maturity. Okay, so scurvy causes the collagen maturity defect. So how will you remember the clinical features? West Bengal Public Service Commission, tremor field zone seen, tender joint Bimberger ring sign, white line of Frankel. You can see this. You can see subperiosteal hemorrhage, scurvatic zone, tremor field zone, it is also known as ring epiphysis, Pelkan spur. Okay, white line of Frankel. These all are the features of scurvy. Lab parameters are normal because it is due to vitamin C deficiency, and you have to remember that scurvatic rosary are tender, and in rickets it is non-tender. This is the question they may ask to you. White line of Frankel is seen white. Her lap is cozy. What is her lap is cozy? Healing rickets, leukemia, plum sim, scurvy, congenital syphilis. These, in all these there is a white line of Frankel. Next is osteoporosis. So osteoporosis is bone quality is normal, but quantity is decreased. Every parameter is decreased. Okay, pain in back is the earliest symptom. Most common earliest fracture is vertebral fracture. There are two type of osteoporosis. So are you getting this metabolic bone disease? So metabolic bone disease, first is hyperparathyroidism. So hyperparathyroidism is due to excess of PTH, and excess of PTH, it could be due to primary or secondary. So primary, it is due to parathyroid adenoma, parathyroid carcinoma, which causes increase in PTH release. So what is the action of PTH? So what is the action of PTH? It increases the absorption of calcium and phosphate from intestine, and in renal it causes calcium absorption and phosphate excretion, and in bone it causes bone resorption. So these are the features of this is the action of PTH. So what will it cause in bone? Because it is hyper PTH. So in skull it is causing salt and pepper appearance, and in tooth it causes resorption of lamina dura. In phalanges it's causing brown tumor. Okay, so these are subperiosteal bone resorption. So these are the feature of hyperthyroidism. So it could be primary or secondary. So primary is due to it's due to cause in parathyroid, and secondary is due to hypocalcemia. Next is rickets. So rickets is due to vitamin D deficiency, and it is seen in kids, in infants. Okay, so vitamin D deficiency in infants, it causing the ping pong like skull. Craniotabs, because calcium is deficient, so bone is weak, so bone can be bows. That's why bowing of bone, cupping, splaying, fraying, you can see in physis. Okay, there are two types: vitamin D dependent. So vitamin D dependence mutation in 1-alpha hydroxylase gene. Vitamin D dependent type 2 is receptor resistance in vitamin D. Okay, and how can you remember this? हरा पिक DC हो गया. So you will find all the clinical features and every detail in this mnemonic. Harrison sulca, ricketic, rosary, ping pong like skull, genu varum, delete closure of front nail, craniotab, hypoplasia of enamel, and genu valvum. So left finding, you will find calcium decrease or normal. I have explained you why it is normal, because it causes the reflex in release of parathyroid. So parathyroid hormone maintain the calcium. Osteomalacia is due to vitamin D deficiency in adult, and scurvy, so vitamin C deficiency. Okay, so these all are the features. West Bengal Public Service Commission. Okay, so next is osteoporosis. So in osteoporosis, bone quality is normal, but quantity is less. Okay, female is involved most commonly. It is seen in postmenopausal phase, most of the cases. Okay, earliest feature is vertebral fracture, earliest fracture. Type of osteoporosis, type 1, primary postmenopausal senile osteoporosis. Type 2 is secondary drug induced. Most common complication, fragility fracture. Okay, so Z score is used in older population and T score in younger population. DEXA scan is investigation of choice. Treatment is by giving bisphosphonate, which decreases the bone resorption. Denosumab, SERM, raloxifene, HRT therapy. Teriparatide is increase the bone formation by stimulating osteoblast, and bisphosphonate inhibit the osteoclast action, so inhibit the osteoporosis. Zoledronate given once in a year. Romosozumab, it enters clostridium. Vertebroplasty is used for kyphosis. Now the mnemonic: A, B, C, D, E, F. Age, it is the most common cause. B is for bisphosphonate, drug of choice. Cord fish vertebra is radiological feature. DEXA scan is investigation of choice. Estrogen, it is protective in osteoporosis. Female is more commonly involved than male. Okay, so osteoporosis is it is all the parameters are normal. Paget's disease, so Paget's diseases, it is more commonly seen in male than female. It has 3 stages: lytic, mixed or blastic. Most common manifestation is pain associated with paramyxovirus association. Pelvis is most commonly affected than tibia. It is due to increase in osteoclastic activity. Okay, increase in bone resorption, increase formation by osteoblast, increase bone turnover, increase in ALP, enlarged head, headache. So these all because disorganized osteoclast activity, it leads to abnormal formation of bone. Abnormal formation bone leads to cranial nerve stenosis, क्योंकि नर्व उसी से निकलती हैं, कैनाल से. So abnormal bone formation होगा तो क्या होगा? Nerve will compress. Mnemonic is deep cop TEM ने IV cannula लगाया. So deafness, cotton wool skull, picture frame vertebra, temocenter skull, cranial foramen stenosis, otosclerosis, ivory vertebra, cardiac output is high. Bone is warm to touch, thick and weak bone. It is frequent changes, head size. So because it is due to increase in osteoclastic, disorganized bone turnover, increase in bone resorption. So Paget's disease is disorganized bone turnover. Okay, lytic phase, patient will present with osteogenesis circumscripta, flame-shaped blade glass appearance. Mixed phases, picture frame vertebra, IV vertebra, cotton wool skull. Blastic phase is temocenter skull. Okay, osteogenesis imperfecta, patient present with multiple frequent fracture. Cola1 gene is affected, features with blue sclera, bruising and delayed dentition. Okay, so let's talk about the various parameters and diseases. So just remember, ALP is increase in every disease except osteoporosis. In osteoporosis, everything is normal. Okay. So in rickets, serum calcium is decreased. So it reflexly, aided by positive feedback, increase the serum PTH. So serum PTH is increase in blood, which causes the absorption of calcium and excretion of phosphate in kidney. So it is causing excretion of phosphate in kidney. So phosphate level is decreased and ALP is increased. Now, in renal osteodystrophy, it is in chronic kidney disease. So in chronic kidney disease, renal function is impaired. So because renal function is impaired, so calcium is excreted. So calcium level in blood is decreased. So calcium level in blood is decreased. So it increase the PTH level. So now you will ask why? Because PTH level is increased, so serum phosphate should be decreased, but it is not decreased because PTH action is to increase the absorption of calcium from kidney and excretion of phosphate. But in this case of renal osteodystrophy, in chronic kidney disease patient is not able to excrete the phosphate, so serum phosphate will also increase. So that's why it is highly increased in renal osteodystrophy. And ALP level increase, osteoporosis, everything is normal. Primary hyperparathyroidism, PTH level is high. So serum, because PTH level is high, so serum calcium is high, and PTH decreases the absorption and increases the excretion. So phosphate level is decreased and ALP level is increased. Now Paget's disease. So Paget's disease is ALP level because of disorganized. It is due to disorganized calcium and phosphate metabolism. So everything is normal, but ALP is increased. Okay.